And joining us is South African editor and journalist Candice Bailey to react to the address by President Cyril Ramaphosa. Candice, how's it going?
Good evening.
Good evening. Now, quite a number of restrictions announced by the president this evening. What other changes do you think we should be aware of?
So in addition to there being no gatherings over the next 2 weeks particularly, there's also a curfew that's been put in place from 9 p.m. until 4 a.m. He's also saying to us that the schools will close earlier than expected. They were going to go on a break towards the end of July. They'll now go on a break from Friday. And in addition to that, they'll also have no alcohol sales across the country for the next 2 weeks, which is going to be quite a blow. Restaurants will also only be able to offer takeaways. They won't be able to accept any patrons. So those are some of the biggest changes that are going to be expected in the next week.
All right. Now, the information is clear that the Delta variant is overtaking the Beta variant in prevalence in South Africa. What do we know about this new variant, Candice?
So this evening, that the variant is expected to last a lot longer than the previous two waves. So our first wave lasted for about 15 weeks. Our second wave lasted for about 9 weeks. And because of this variant and the way it's spreading, we believe that it's going to mean that the wave that we're currently in is going to last for a lot longer. We do know that the infection rates are very high. Gauteng, which is our economic hub, is at the moment experiencing 60% of the cases. Collectively, we've had 1.9 million cases.
Now, these restrictions were necessary based on the way the virus is spreading. What reasons have been adduced for the rate of its spread, Candice?
Mainly, Chuks, is the fact that our hospitals are unable to cope with the current loads that we have at the moment. Most of our hospitals are reaching capacity, particularly in Gauteng. ICUs there aren't any beds available. What the president told us this evening is that they've had to open up additional beds by pausing elective surgeries, as well as finding additional beds via new technology. Yet he didn't give much detail, but there's definitely a shortage of healthcare workers. We've called in the army, the military, to help us address the healthcare shortages. And he's also made provision for more healthcare workers to come and join in, just so that we can deal with the current loads of patients in hospitals.
Now, the announcement has just been made, yes, but do you have a sense of what the reaction will be or has been among the populace so far?
Already, Alcohol Policy Alliance groups are happy that the alcohol ban has been put in place. They've been advocating for alcohol restrictions since the beginning of lockdown. And I mean, their argument is that when people drink, they are unable to maintain social distancing. They also fill up the ICU beds in hospitals, so they are very happy already. The hospitality industry is likely to also have an effect, is also likely to be upset about this. But the president was at pains to mention this evening that it's only for 2 weeks and that we will be reviewing it. And these recommendations from the National Command Council, as well as the Ministerial Advisory Committee, will be under review in 2 weeks' time again.
Now, we know the last time we spoke, I got a sense from you that the vaccination, rate in South Africa has not been very impressive. How does this tie in, to this particular announcement and, of course, the rise in the spread of the Delta variant?
Look, I mean, we have to continue with our vaccination drive. What our president said to us this evening is that 2.7 million people have been vaccinated. About 900,000 of those are healthcare workers. He has also mentioned that we are now moving into a second phase of our vaccination campaign, which is the second cohort of people, which is the people between the ages of 50 and 59, that will be able to have to be vaccinated. Teachers are also being vaccinated, and very shortly from next week we'll have police officers and other essential workers also vaccinated. So it's I think the president feels it's very important that we continue the vaccination drive. We're not doing it as fast as he wants to, but it's definitely a step that needs to be taken.